A comprehensive exploration of schizophrenia. Understanding schizophrenia. Schizophrenia is a severe mental illness that, without proper care, can lead to disability. Approximately 1% of Americans grapple with this condition. Individuals with schizophrenia may experience auditory hallucinations, visualize imaginary scenarios, or harbor the belief that external forces manipulate their thoughts. Such encounters can induce fear and provoke erratic behavior. While there is no cure, effective treatment strategies can generally mitigate the most debilitating symptoms. It is crucial to dispel the common misconception that schizophrenia is synonymous with multiple personality disorder. Identifying symptoms. The symptoms of schizophrenia encompass hallucinations, perceiving non-existent sights or sounds; delusions, maintaining strongly held false beliefs; catatonia, a state where individuals become physically immobile for prolonged periods, engage in bizarre movements, or exhibit inappropriate responses to others. Certain indicators, such as diminished enjoyment in daily activities and social withdrawal, may resemble symptoms of depression. Cognitive impacts. Individuals with schizophrenia often struggle with organizing their thoughts and establishing logical connections. They may perceive their minds as leaping from one unrelated idea to another. Thought withdrawal, the sensation that thoughts are being extracted from their minds. Or thought blocking, an abrupt interruption in the flow of thinking, may also manifest. Behavioral consequences. Schizophrenia exerts a profound influence on various aspects of life. Affected individuals may engage in incoherent speech or invent words. They might display agitation or exhibit a lack of facial expression. Many encounter difficulties in maintaining personal hygiene or keeping their living spaces tidy. Despite prevalent stigma, the risk of violence towards others remains minimal. Demographic distribution. Schizophrenia can affect anyone, irrespective of gender or ethnicity, with symptoms typically emerging between the ages of 16 and 30. Early signs may precede the first incidence of full psychosis by weeks, months, or even years. Onset is often earlier in men than in women, rarely occurring in childhood or after the age of 45. A familial history of schizophrenia or other psychotic disorders may elevate the susceptibility to the condition. Exploring causes. The precise etiology of schizophrenia remains elusive. Genetic factors, life experiences, and environmental factors may all contribute. Theories posit dysregulation in specific brain regions, neurotransmitter imbalances, especially involving dopamine and glutamate, and structural anomalies such as enlarged fluid-filled cavities, or ventricles, in the brain. Exploring subtypes of schizophrenia, a diverse spectrum of symptomatology. Schizophrenia, a complex mental disorder, manifests in various subtypes, each characterized by distinct features and symptomatology. Understanding these subtypes is essential for tailoring effective interventions and support strategies. Here, we delve into the different subtypes of schizophrenia. Paranoid schizophrenia. Unique features. Individuals with paranoid schizophrenia often experience prominent delusions and hallucinations, primarily auditory in nature. These delusions typically involve themes of persecution or conspiracy. Cognitive impact. Despite the presence of pronounced positive symptoms, cognitive functioning may remain relatively intact. This subtype often retains a higher level of daily functioning compared to other subtypes. Disorganized schizophrenia. Distinct characteristics. Disorganized schizophrenia is characterized by disorganized thinking, speech, and behavior. Individuals may struggle with forming coherent thoughts and exhibit unpredictable or inappropriate behaviors. Speech abnormalities. Speech abnormalities in disorganized schizophrenia can range from incoherence to derailment, where the individual's train of thought deviates abruptly. Catatonic schizophrenia. Unique presentation. Catatonia involves a range of motor abnormalities, from stupor, motionless and mute, to hyperactivity. Individuals may exhibit peculiar postures or repetitive, purposeless movements. Potential severity. Catatonic schizophrenia can manifest with extreme variations in motor activity, and individuals may require close monitoring due to the risk of catatonic stupor or excitement. Residual schizophrenia. Persistent symptoms. Residual schizophrenia is characterized by a history of significant symptoms. Even though the current presentation may involve milder forms of delusions, hallucinations, or negative symptoms. Chronicity. This subtype often represents a chronic course of the disorder, with individuals experiencing residual impairments in functioning and persistent negative symptoms. Undifferentiated schizophrenia. Unclear symptom dominance. Undifferentiated schizophrenia is a category used when symptoms do not clearly fit into one of the above subtypes. Individuals may exhibit a mix of positive and negative symptoms without a predominant feature. Diagnostic challenge. Diagnosis of undifferentiated schizophrenia may be challenging due to the absence of a clear symptom pattern, requiring careful clinical assessment. Understanding the distinctions among these subtypes is crucial for clinicians in determining appropriate treatment approaches. It's essential to note that individuals with schizophrenia may experience a combination of symptoms from different subtypes over the course of their illness. The classification of subtypes aids in clinical formulation, guiding treatment decisions, and fostering a more nuanced understanding of the heterogeneous nature of schizophrenia. As research advances, further refinements in our understanding of these subtypes may contribute to improved diagnostic precision and targeted therapeutic interventions. Diagnostic approaches. No definitive lab tests exist for schizophrenia diagnosis, hence, medical professionals rely on a person's history and symptoms. Exclusion of alternative medical causes is the initial step. In adolescence, a combination of family history and observable behaviors may aid in predicting schizophrenia onset. The prodromal period, preceding full psychosis, may be challenging to identify due to its subtle behavioral changes, particularly in teens. Pharmacological intervention. Prescription medications play a pivotal role in alleviating symptoms like aberrant thinking, hallucinations, and delusions. However, some individuals may experience undesirable side effects, such as tremors and weight gain. Potential interactions with other medications or supplements also exist. Nonetheless, medication is generally indispensable for managing schizophrenia. Therapeutic approaches. Counseling facilitates the development of effective coping mechanisms for problematic thoughts and behaviors, enhancing interpersonal skills. Timely intervention improves outcomes significantly. Cognitive behavioral therapy, CBT, focuses on reality testing of thoughts and symptom management. While other therapeutic modalities aim to enhance self-care, communication, and relationship skills. Functional rehabilitation. Schizophrenia rehabilitation programs teach essential life skills, including public transportation usage, financial management, grocery shopping, and job acquisition and retention. The most effective programs incorporate a collaborative approach like coordinated specialty care, CSC, integrating medication, therapy, social services, and employment and educational interventions. Neurobiological basis of schizophrenia, unraveling the complex web. Schizophrenia, a multifaceted mental disorder, has been the subject of extensive research aimed at unraveling its neurobiological underpinnings. Understanding the intricate interplay of brain structure, neural circuitry, and neurotransmitter systems provides crucial insights into the etiology of this condition. Brain structure. Enlarged ventricles. Structural abnormalities often manifest as enlarged fluid-filled cavities, or ventricles, in the brain. Recent studies suggest a correlation between ventricular enlargement and the severity of symptoms, indicating a potential biomarker for disease progression. Prefrontal cortex dysfunction. Dysfunction in the prefrontal cortex, a brain region crucial for decision-making and emotional regulation, has been implicated. This dysfunction may contribute to the cognitive deficits observed in individuals with schizophrenia. Neural circuitry. Dysregulation in neural networks. Neuroimaging studies reveal dysregulation in key neural networks, including the default mode network, DMN, and the salience network. Disruptions in these circuits may underlie cognitive and perceptual disturbances characteristic of schizophrenia. Hippocampal abnormalities. The hippocampus, vital for memory and spatial navigation, exhibits structural abnormalities in individuals with schizophrenia. Understanding the impact of these abnormalities on memory and cognitive function is an ongoing area of investigation. Neurotransmitter systems. Dopamine hypothesis. The dopamine hypothesis has long been central to schizophrenia research. Recent advancements in neuroimaging techniques have provided more nuanced insights into dopamine dysregulation, emphasizing the role of specific dopamine receptor subtypes. Glutamate dysfunction. An emerging focus involves the role of glutamate, a major excitatory neurotransmitter. NMDA receptor dysfunction and glutamate imbalances are implicated in the cognitive deficits observed in schizophrenia. Targeting glutamatergic pathways represents a promising avenue for future therapeutic interventions. Serotonin and GABA. Investigations into the roles of serotonin and gamma-aminobutyric acid, GABA, have expanded, shedding light on their contributions to mood regulation and inhibitory control. Imbalances in these neurotransmitter systems may contribute to affective and cognitive symptoms. Recent research findings and advancements. Genetic contributions. Advances in genomics have identified specific genetic factors associated with schizophrenia susceptibility. Understanding the genetic architecture provides valuable insights into the heritability of the disorder. Epigenetic modifications. Epigenetic studies reveal alterations in DNA methylation and histone modifications in individuals with schizophrenia. These epigenetic changes may contribute to the interaction between genetic predisposition and environmental factors. Inflammatory pathways. Growing evidence suggests a link between immune system dysregulation and schizophrenia. Inflammatory pathways and cytokine imbalances may contribute to neuroinflammation, impacting neural function and connectivity. Connectomics. Network-based approaches, such as connectomics, are transforming our understanding of schizophrenia. Analyzing large-scale brain networks provides a holistic view of how disruptions in connectivity contribute to symptomatology. Adherence to treatment plans. Individuals with schizophrenia may discontinue medication due to side effects or lack of insight into their condition, heightening the risk of symptom recurrence and subsequent psychotic episodes. Regular counseling plays a crucial role in fostering treatment adherence and preventing relapses or hospitalization. Employment challenges. Securing and maintaining employment proves challenging for individuals with schizophrenia due to its impact on cognition, concentration, and communication. Vocational and occupational rehabilitation can aid in cultivating practical job skills, improving employability. Supporting loved ones. Relationships involving individuals with schizophrenia often face difficulties due to unconventional thoughts and behaviors, leading to social isolation. Treatment, including relationship-focused therapy, can ameliorate these challenges. Support groups or counseling for family members can offer valuable insights and assistance. Substance abuse risks. Individuals with schizophrenia exhibit a higher likelihood of substance abuse compared to the general population. Some substances exacerbate symptoms, necessitating targeted substance abuse programs tailored for this population. Preconception discussions. Women with schizophrenia planning pregnancy should consult their healthcare providers regarding the safety of their medications during pregnancy. While studies on schizophrenia drug safety during pregnancy are encouraging, discussing potential risks with a healthcare professional is crucial. Supporting relatives. Encouraging individuals with schizophrenia to seek help can be challenging. Treatment often initiates following a psychotic episode requiring hospitalization. Post-stabilization, family members play a pivotal role in encouraging medication adherence, accompanying them to follow-up appointments, providing ongoing support and respect. Preventive measures and early intervention strategies for schizophrenia. Preventing the onset and mitigating the impact of schizophrenia involves a combination of awareness, early detection, and targeted interventions. While schizophrenia may not always be entirely preventable, recognizing early signs and implementing timely interventions can significantly improve outcomes. Here are key preventive measures and early intervention strategies. Public awareness and education. Community outreach programs. Implement educational programs to increase awareness about the early signs of schizophrenia within communities, schools, and healthcare settings. Destigmatization efforts. Reduce stigma surrounding mental health issues to encourage open discussions and prompt seeking of help. Early identification of risk factors. Family history. Identify individuals with a family history of schizophrenia or other mental health disorders, as they may be at an increased risk. Regular monitoring and support can be initiated for this high-risk group. Mental health screenings. Routine assessments. Incorporate routine mental health screenings, especially in adolescence and early adulthood when symptoms often emerge. This can facilitate early detection and intervention. Psychoeducation programs. Targeted education. Provide psychoeducation to at-risk individuals and their families about the early signs and symptoms of schizophrenia. This knowledge empowers individuals to recognize changes in behavior or thinking patterns. Cognitive behavioral therapy, CBT. Early intervention programs. Introduce CBT as part of early intervention programs. CBT can help individuals recognize and manage distorted thought patterns, potentially reducing the severity of symptoms. Supportive environments. School and workplace support. Create supportive environments in schools and workplaces that foster mental well-being. Encourage communication about mental health issues and provide resources for seeking help. Crisis intervention teams. Community-based teams. Establish crisis intervention teams within communities to respond promptly to individuals experiencing acute mental health crises. This includes trained professionals who can assess and provide immediate assistance. Accessible mental health services. Reducing barriers. Ensure accessibility to mental health services by reducing barriers such as cost and stigma. Timely access to mental health professionals can facilitate early diagnosis and intervention. Family involvement. Open communication. Encourage open communication within families. Family members often play a crucial role in identifying early signs and supporting individuals in seeking professional help. Research and innovation. Investment in research. Support research initiatives focused on identifying biomarkers, genetic factors, and other indicators that may aid in early detection. Innovation in diagnostic tools can contribute to more effective preventive measures. Medication adherence programs. Educational initiatives. Implement programs that educate individuals diagnosed with schizophrenia about the importance of medication adherence. Consistent medication management can prevent relapses and minimize symptom severity. Your health matters. Quali.health